Hey everyone, Dr. Sully here at Sullivan Dental Partners. One of the common questions we get when it comes to this all on X, all on 4 is, well, how many implants am I going to get? Now, I think one of the cool things that we do here at Sullivan Dental Partners is we don't nickel and dime you when it comes to the amount of implants you get. Meaning, I'm an over-engineer guy. And so typically what we're trying to do is we're trying to put as many implants as we can relative to the bone and the bone quality that you have. And so at most, that's typically going to be somewhere between 6 or 7 implants. Now, it's not very realistic to get that many implants in due to the quality of the bone you might have or the amount of the bone you might have. You may have good quality, but just not a lot of it. You're still a candidate, we just can't get 6 implants. The minimum amount of implants that you need to have is 4. That's where the kind of conversation or why you hear this term called the all on 4, because a lot of doctors will do 4 and only 4 just to minimize some of the cost, etc. But you do need to have at least 4 implants. What we know is that if you go down to 3, we see significant drops in the long-term predictability of the implant and the prognosis. So at minimum we need 4, and then at our office we're typically going to try to treatment plan at least 6 implants. That's kind of the sweet spot, but it's very common that we do 5 implants, and sometimes we have to do 4 just because of the bone quality. That's a great question you can ask, kind of what our expectation is. Obviously, it's not a promise because once we get into surgery, it can change. But what I do promise you is that what we do here is we do not set our fees or change things based off the outcome of that. And we try to maximize what we can do by giving you as many implants as you can so that down the road, say 1 implant fails, if you've got 6, no problem. You've already got 5 to keep going. So that's kind of the way that we look things. We truly believe in over-engineering, and that's why we don't charge by the implant.